Welcome to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti. My guest this evening is Janet Stolfi-Alfano from the Diaper Bank of Connecticut. Janet, welcome. How are you?
Thank you. I'm well. How are you?
Good. Good to see you. It's been a while.
It has been a little bit.
It has been. So tell us a little bit about yourself and what exactly the Diaper Bank of Connecticut does.
Sure. As you said, I'm Janet Stolfi-Alfano. I'm the CEO of the Diaper Bank of Connecticut. We're a nonprofit that provides diapers, period supplies, and incontinence products to folks in need throughout the state of Connecticut.
Okay.
And we do that in partnership with organizations that are already serving families across the state, so that it's a network who are closely connected to the families they serve.
Right.
And you know, they're already going there for something.
Right.
So it's not like we're adding another stop for a family to have to go to get the essentials that they need.
Right.
And part of what we do is provide those items, but also what we do is look for other solutions as well, you know, public policy solutions, public support to ensure that these items are available and accessible to anyone who needs them.
Now tell us a little bit about your background and how you became
Involved.
Yeah,
so I went to school. I have a master's in social work, policy practice, and that just means you learn the basics and you learn a little bit about how public policy can change systems and how policies can move the needle a little bit faster than sometimes the one-on-one philanthropy can. So our focus is on ensuring that we're providing the items, as I said, but then also moving public policy to ensure that, like I said, families have access to what they need. So after social work school, I was looking at the want ads for a job, and I saw an ad for the Diaper Bank. And I hadn't heard of the Diaper Bank before, but it was a little bit of a joke in my house because my youngest son, Charlie, had just finished potty training. So we made a joke like, we don't want anything to do with diapers. We just finished potty training our second child. But you know, I went on the interview and spoke with our founder and really was so motivated and inspired. I really wanted the job.
Okay.
And that was back in 2007. I was hired as the operations manager and then became the leader of the organization in 2011.
Oh, nice.
Yeah.
You like it?
I love it. It's still fun. It's like a complex puzzle to try and figure out how to ensure families have what they need and that you will be around as an organization to continue to meet those needs. So it's always a puzzle, but you get to meet a lot of people and hopefully do some good work at the same time.
Now tell us about the Healthy Baby Diaper Drive that you guys just finished up.
Yeah, so this is the second year that we completed the Healthy Baby Diaper Drive. It was a statewide diaper drive and an effort to raise funds to get more diapers to more families.
Okay.
We came so close to our goal, but we are excited about the really folks' ability to get engaged and involved in the work and have an understanding of, you know, I'm buying a pack of diapers for a family for this drive, but really what this might mean to a family. It's so critical. It seems like such a small thing to run to Target, grab a pack of diapers, but families are going without.
Oh, yeah.
And so for us, it's a good opportunity to use the drive as a point of education for families and just to drive home how important the distribution piece is and the advocacy.
Now, what type of advocacy do you guys do?
So really a number of different things. We've been involved in advocacy efforts to, for instance, eliminate the sales tax for diapers and period supplies, which went into effect in 2018. We're working now to convene with folks who understand that diapers are important to the health and well-being of babies and families, for the actual health impacts from, you know, diaper rash or other more severe things, but also, you know, the economic impacts that has and impacting a family's ability to bring their child to child care and then attend work or attend school. So this one small thing is a proxy for what good public policy can do if it is made available to everyone.
Now, how closely do you guys work with the governor's office and the state legislature?
You know, Connecticut is really, I mean, we're really lucky, I would say, to live in Connecticut. You know, Connecticut has long been a leader in this issue in particular. We're one of the oldest diaper banks in the country, and Connecticut was the first state to have a line item in its state budget to support diapers for a diaper bank.
Okay.
So there's a lot of legislative champions across the state, and you know, we've worked with the governor's office over many years, in years past as well, to have proclamations around understanding the impact of diaper need.
Right.
So there's really a lot of leadership that happens in Connecticut, particularly on this issue, and we are working now with several legislative champions, but in particular, Representative Jillian Gilchrist has convened a task force to look at diapers and other health-related social needs to have coverage under Medicaid, which is, you know, really gets a little bit in the weeds, but we're excited about the state's willingness and the legislature's willingness to examine this further. You know, what can we do? How can we better spend dollars on the front end to prevent an illness like a diaper rash or something that could be more severe down the road? And when those folks bring their children, what ends up happening is they go to the emergency room, which is a very costly visit.
Oh, yeah.
Right? So preventing something like that is much less costly and much healthier for a child and economically healthier for the whole family.
Right.
So we're really excited about that work as well. But the state, again, Connecticut is a state where we have, you know, cities, we have rural communities, we have suburbs. It's kind of a snapshot of our country with a lot of different demographics represented.
Right.
And we're in a unique position as a state to really be innovative in our approach, in particular in how we think about these health-related social needs. And is there a way for us to think about the vast resources that not just state government, but that the state has as a whole, and put them to use where they will have a great impact on a young family and a young child?
Now, tell us a little bit about, I guess there's new data shows that diaper needs 1 in 250, which is 50% of babies experience diaper need, and that is up almost 33%?
Yeah, so the statistic is, so in the past, it was 1 in 3.
Okay.
1 in 3 babies, so about 33%
Right.
experience diaper need. And in a recent national diaper bank network called the Diaper Check 2023, it is estimated that it is closer to 1 in 2, so that almost 50% of children experience diaper need,
Okay.
which really is just defined as, you know, a family's inability to provide enough diapers to adequately change
Right.
their child's diaper. So that's a significant increase. And we know that so many of the families that we serve were the most impacted in COVID with, you know, companies shutting down, hours reducing, job loss, where all those gains, you know, come back to those families.
Yep.
We think that they are still really feeling the economic strain of that. And so that's where we're seeing this statistic come into play. And so we know that that need has not gone away, and that we still have to work just as hard, if not harder, to ensure that we can meet the needs of the families who need diapers.
Now, tell us a little bit about the Diaper Connection program and how that works.
Yeah. So Diaper Connections is a collaborative effort between the Diaper Bank of Connecticut and the Connecticut Hospital Association and hospitals across the state. And this was funded through, it was emergency COVID dollars that were administered through the Department of Housing. There was a particular grant called the Small Cities Grant.
Okay.
They made some excess funds available during COVID, and we had connected around, is there an opportunity for us to actually help families impacted by diaper need during COVID?
Okay.
And so that's where this collaboration was born. And, you know, what a unique way to both connect families to resources, but also ensure that hospitals have a firsthand look and an understanding of how critical something like this is. Folks who work at hospitals have a lot on their plate, and they're trying to serve communities at really their most vulnerable times, many times. And so this partnership looked at how can we work with hospitals and to ensure that they are also working with the communities in which they live and work.
Right.
So many hospitals chose to distribute diapers and other supplies right in their physical space, and others also added some community partners. So it was really expanding the network of community partners that are doing distribution across the state. And a critical piece to the program is the collection of data and health-related data.
Okay.
So we screened every family for a diaper need, and then captured that data, and then distributed products, diapers and other products, took demographic data from the folks who were receiving diapers, and then the next step is looking at the health-related outcome data from the hospital so that we can actually see what the impact was to emergency visits and other health-related activity, so that we can further quantify diaper need and this remedy that is so cost-effective.
Would you mind sticking around for another segment?
Sure.
All right, we'll be right back.
Hey world, I have a quick message. It's about safe driving. All right, let's go. Anytime you're driving, have the seatbelt buckled tight. Both hands on the wheel and your phone out of sight. When not in your hand trying to text somebody back. Because if you do, your car might get smacked. The moral of the story, just put your phone down. The people on the road will stay safe and sound. Put your phone down, put your phone down. People on the road will stay safe and sound. Yeah.
Smart TVs and streaming services have taken over the television industry. VSC TV is proud to announce our presence on Apple TV and Roku to make watching your favorite shows even easier. You can access this service by downloading the Cablecast ScreenWeave app. Then choose Valley Shore Community TV from the list of channels. Select VSC TV Live to watch our channel in full HD. Or pick a show from our on-demand video library. VSC TV is your local Connecticut Mid-Shore Valley digital connection.
Welcome back to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti, sitting here with Janet Stolfi-Alfano from the Diaper Bank of Connecticut. Welcome back.
Thank you.
Thank you. Okay, so one thing we didn't talk about in the first segment is we talked about the warehouse and distribution in the first segment. How I want to open this segment is if somebody drops off a donation and somebody needs to get that donated product for them, for themselves, for their child. How do they go by doing so? I'm assuming you can't go to your warehouse and knock on the back door, knock, 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 I'm here.
Yeah, sure. So I'll start us right at the point of the donation. So
Okay.
folks donate sometimes product to us and sometimes dollars.
Okay.
And one benefit of that financial donation is we can make that go a little bit farther. We can buy more diapers with the exact same amount than you would by going to Target, because we are buying in such large quantities. So we're buying a full truckload at a time. It's close to double.
Wow.
It's close to double. So anyway, so that donated diaper or donated dollar turns into a diaper
Okay.
magically, and then we will put it in an order to a local partner agency across the state of Connecticut.
Okay.
So we will deliver that diaper or a bunch of diapers to the agency, and then that agency is working with families in the way that they normally would, and then they would distribute diapers in the manner at which best suits their agency. So we have some partners who are early childhood providers, and they may give diapers right in the center in the program.
Right.
So that's, they just work that right into what they normally do. We have other programs who do, say, home visiting. And so they have workers who do visits to families, and that's an established program that is separate from us, but they incorporate diapers into that program. So they have a visitor going to a family with a young child who may need home visiting, and they bring diapers. And it's a way for them to meet the need of that family, and also an opportunity for them to engage with the family better. So for example, you know, you're a young mom, you have a young child, and you have financial constraints.
Right.
This person who's working with you is recognizing how expensive these products are and is bringing them to you, like meeting you right where you are. And so we've heard over and over again, and there is some empirical data to support this as well, that diapers are a great tool for home visitors to use to engage further with a family.
Okay.
Again, a number of different ways in which folks distribute, but really what we wanted to ensure was that it was seamless in the way that those organizations already operated. It still worked for them, and so we are grateful for all of the partners that we have across the state of Connecticut, because they are truly doing this, you know, logistics. Not all of them thought they were going to be in the diaper business,
Right.
but recognizing that the families that they serve really value it as a service, and then they in turn wanted to be able to provide it. So we are truly grateful for all those kinds of partners, but it's really in a way that already flows with the work that they're doing.
Okay.
So if a family is in need, they can, you know, reach out to one of those partners, and we have a list on our website, which is thediaperbank.org, and, you know, reach out to one of the partners if they're able to, based on their capacity and our capacity. Certainly they could sign up.
Now, where are your facilities located?
Our warehouse right now, we're in North Haven on
Okay.
State Street. You know, we are pretty central in the state.
Okay.
And we like that location, certainly. We're always thinking about ways that we can be innovative and use our resources to their fullest capacity. So we're always looking at, you know, new partners in transportation and space. So we're really excited about how we can best use resources to make sure that we can get more diapers to families.
It's got to be pretty impressive when the tractor trailer truck full of diapers pulls in.
It is pretty amazing, and it's really funny because, you know, again, over this many years we've seen so hundreds and hundreds, and it's still amazing how big a whole tractor trailer full of diapers is. So it's 30 pallets, in case you're wondering. But yeah, it's really exciting to see them come.
30 pallets of diapers fill a tractor trailer.
Yeah. It's about, depends on the sizing, but about 250,000 to 300,000 diapers would be in a full truckload.
Oh my goodness.
It's a lot of diapers.
Oh my goodness. Wow.
Yep.
Then they have, once they get offloaded, you probably have a team that sorts them. And
Yep, we have a team, counts, sorts, and then gets orders ready to send out to our partners across the state.
now, how's that work out? Do you have a fleet of vehicles that deliver all over the state?
You know, actually, right now we have one truck, and if we need a second one, you know, we get it for a shorter amount of time.
Gotcha.
Yep. So always picking and packing and driving deliveries out to organizations.
Now, I'm sure you have affiliates here on the shoreline.
Yep, we have partners all over, and if you put me on the spot to try and name any, I'll lose it.
Don't do it. Don't do it.
Well, it's interesting now from when I started, just how much growth has been in the partner agencies, and because our staff has grown as well. You know, my staff is in much, you know, more regular contact with the partners than I am. So it's really exciting to see the growth and to see all the new faces and partners, and to see how much everyone values this and understands what a great need it is in their community. I think that's the most amazing part.
Now, as far as Let's talk about diapers and other health-related social needs, the working group.
Yeah, so I touched upon that a little bit, and it is truly exciting.
All right.
Like I said, we're trying to think about how can we have diapers considered coverable under Medicaid, because incontinence products for adults and for children who have special health-related needs are already covered under Medicaid. We think that diapers for infants and toddlers should also be covered under Medicaid because of their preventative health qualities. And so that is what the working group is about, that we talked about a little bit earlier.
Okay.
And one of the things that we're doing in order to try and be innovative, which I think is one of the next things that I said that we would talk about, it really flows right into it, is what we're trying to do is become a licensed provider of diapers for older adults, so incontinence products,
Right.
and for children with special needs. And the way that those get paid for those special populations can be through Medicaid. And so we want to become licensed to be able to get reimbursed, so that we can help serve more families who have that need, who maybe don't even realize that they qualify at this point for coverage. So we can actually assist them and have a little bit of revenue that will help us sustain our distribution moving forward.
Now let's talk about the innovation at the Diaper Bank of Connecticut, creating sustainable revenue stream and supporting more families.
Yeah. So again, just touching upon that a little bit prior to this. So the revenue recognized from getting reimbursed for incontinence products and diapers for children with special needs would actually be used to help support all of the folks who don't have coverage under Medicaid. So it will help us really just diversify our revenue. So, we look to state funding and sometimes federal government funding, particularly during COVID.
Okay.
We have private foundation grants and individual donors, generous donors who support us all through the year. It's not enough to meet all of the need that exists in our state right now. Almost 70,000 children aged 0 to 3 could technically use our services. And yeah, right, it's an astonishing number for a small state like ours. So what we're trying to figure out is how can we be innovative and create a revenue stream around work that is closely related to work that we're doing.
Right.
And so, we've had some support, generous support from a foundation to actually help us do this, to help us run the numbers. Is this viable? Does it make sense? And they've said, yeah, this really makes sense. You've got to go for it. And so that's what we're working on right now. And so we're really excited about the possibility of that, and that how it helps us continue to think about making the case for Medicaid coverage for infants and toddler diapers as well. So stay tuned. We're going to have a lot of news coming up in 2024, I think.
Oh, wow. Now, are you guys state funded, or do you count on private donations, or people want to open their checkbook, make the donation, or go online and make the donation? How's that work?
Yep. So we do have some state funding, again, but we rely on, it's very restricted, so we rely on individuals, generous donor support. Absolutely. Folks can make a donation. You could send us a check or go online to thediaperbank.org. We have a big, giant donate button. You can't miss it, right on the front page of the website. But certainly, we are grateful for the generous support we have, both from the state, but from all the individuals across the state who support us as well. And just know that it's truly going to families who need it, and that we're working to ensure that we can magnify the impact of our work by thinking about these other ways to support this issue.
And just to reemphasize one of my topics from before, people cannot come to your warehouse, knock on the door, say, "Hey, I need diapers."
Yeah, we don't have, we're not staffed to do that, unfortunately, but, and really the point is to go to a community-based organization that you're already working with.
Right.
Or that lives closer to you than our warehouse is. So our warehouse is truly meant to just be a central hub for operations, and then work with your local community partner to get the diapers.
And all the information on who your partners in the community are, everything is on the website, correct?
Yes. Yep, thediaperbank.org.
And as far as, we've got a little bit more time left,
Great.
what else do we want to tell people about the Diaper Bank?
So that, we're known obviously for diapers for infants and toddlers. We also work on distributing and advocating on behalf of greater access for period supplies.
Okay.
And we had legislation last year that was championed by Kate Farrar, Representative Kate Farrar, that passed, which would increase access to period supplies in schools, K through 12, state colleges and universities, shelters, and prisons. And so that's also something where we have some donations. We're creating new avenues to distribute product through there, which is wonderful. And then in the adult incontinence space, that's an area where we distribute through our existing network. We know that there is great need, and we're working to create new partnerships with organizations that are serving adults with incontinence or older adults who have these needs as well. So there's definitely a lot of work for us to do, and we want to ensure that we are supporting the family really across the lifespan. If you think about, diapers for an infant and then period supplies, that's over, decades of time for folks, and then incontinence products for those who might need them, and youth incontinence products too for folks who have a need as well. So really just trying to make sure that we are covering that whole lifespan with these health-related needs.
Janet Stolfi-Alfano from the Diaper Bank of Connecticut, thanks for some time. We'll see you again soon.
Thank you.
Thanks, Janet. On behalf of Janet Stolfi-Alfano, I'm Pete Mezzetti. Thanks, good night. We'll see you next time.